Hello, this is Dr. Zhang again. Today I'm excited to talking about the herbal medicine. And everybody knows that herbal medicine has been everywhere and everybody has some experience with it. But they have not reached the mainstream medical practice. The reason is that none of the medicines has been proven to be effective using randomized clinical trials. So the evidence is not strong in using them. And as a physicians, we always taught about that we need to pay attention to the herbal medicine interaction with the medical treatment, which put the herbal medicine in a negative spin. In this video, I will tell you that herbal medicine can be made as effective as Western medicine. Herbal medicine has been used in human history for thousands of years. And let's look at the system I'm familiar with, the Chinese medicine. I'll tell you that the Chinese medicine actually worked in the past. Even the diagnosis system is not understandable by modern science, but it is effective in their own way. How is that? Let's look at a common diagnosis in Chinese medicine. We call it weak spleen, which patient has diarrhea, poor appetite, and weight loss. So in ancient China, when the cancer is almost unheard of, so herbal medicine in combination actually quite effective in treating this condition. And you can imagine that the treatment actually prolonged patient life. So this is effective treatment. But the same medicine, if you place on now in the modern society, it will not be working anymore. Because we have a precise diagnosis. We know that the above condition can be caused by cancer, pancreatic insufficiency associated with chronic pancreatitis, and celiac disease or GI parasites. So if you treat this patient with herbal medicine as above, it's no longer effective. Can we make the herbal medicine effective in treating current medical conditions? The answer is yes. We just have to follow the next 3 steps to make it work. First step is that we have to use the whole herbs, not just the component from herb medicine. So the reason is that limited study from herbal medicine has found that in a single herbs, there is like multiple, maybe 100 different compounds. And even they are structurally different, but they have the same biological effect. And actually they work together to enhance that effect. So like 1 + 1 = 3 picture. Number 2, we have to use combination herbs. Just like in Chinese medicine, and you can use multiple drugs to enhance the medication effect and help with absorption. From the modern medical standpoint, almost all diseases we're treating clinically are multi-organ systems, multi-gene diseases. So almost all diseases involve multi-organ system and mechanisms. So we rarely treat a disease with single medication. Look at congestive heart failure. We have 4 or 5 different medicines to treat at one time. Blood pressure medicine, we rarely use one medicine. Diabetes, we combine them all together with different mechanisms. So in herbal medicine, it's the same situation. Now with studies coming out from herbal research, and we know each compounds can work on different mechanisms. We have to select a different herb and combine them together to make them more effective. The third step, which is the most important step, is to make herbal medicine more effective and more predictable in their absorption. One problem with herbal medicine is that their absorption in the GI tract is erratic in different patients. And sometimes it's so different in different patients. And also they are affected by the season they are collected and the location it is planted. Why this is happening? It turned out that a fraction of these compounds are compounds called glycosides or polyphenols. So most of these molecules have a sugar cap or several sugar molecules at the end of the molecule. And these molecules are not absorbed, so until they are digested in the GI tract, digest away the glucose or sugar motif. And the end result is called aglycone. Several studies have shown that aglycone absorbs better and has a better effect than the molecules with glucose on as a cap. The GI tract enzyme does not seem to digest them, and they have to be digested by the GI bacteria. We know that a normal person, all absorption happens in the small intestine. And some people may have bacteria in the small intestine and make it absorb better. But 1/3 of the patient does not have any bacteria. So GI bacteria is a topic we'll talk about later. For some people without small intestine bacteria, the molecules have to be digested in the colon. So that will make the absorption very inefficient. There is a solution to this, and the medicine has to be pre-treated to remove all this sugar motif or caps, so make them into a glycol before they're used for the herbal product. Let's summarize. So to be effective for the herbal medicine, we have to use whole herbs, and we use combination herbs to increase their efficiency, and we pre-treat the herbs to into a glycol to make them more predictable in their absorption. With our understanding of the herbal combination and the production process, we made a product, and we try to treat type 2 diabetes. We did a test in the US University laboratory. In this process, we used a rat model of diabetes. So the rats are treated with a high fat and a high carb diet. Then they were given drugs to damage their pancreas. This created a type 2 diabetes model. And in this test, we first test the effect of the herbs. So they are treated with 2 months of herbal medicine. And compared to untreated rats, the hemoglobin A1C dropped down to 6.56 compared to the control group, which is 10.9. This is a dramatic change and very effective. The p-value was less than 0.004. And secondly, we look at in-organ damage. So in contrast with human diabetes, which causes renal function problems, in the rats, it looks like they created more liver dysfunction. So in this treatment, we look at AST, which only have 3.95 in the treatment group compared to 9.1 in control group. So this is also statistically significant. Another problem with oral diabetic medicine is that they cause hypoglycemia. So a lot of time hypoglycemia creates more problem than hyperglycemia because they can cause death and falls and multiple problems. We randomly checked glucose on a daily basis, and this treatment does not cause any hypoglycemia. I think this is the ideal drug for human type 2 diabetes. And next test, we look at figure 2, and we try to see a short-term treatment, see if they can prevent diabetes from happening. So look at from beginning, the glucose was equal, and in a week time, the rats are treated with the herbal medicine from one group, while another group does not start treatment. 1 week after treatment, we give the medication to damage the pancreas. So you can see in another week, the treated group does not have elevation glucose, and while the control glucose went up significantly. Then we stopped the treatment. Now you can see that the treatment group went up, glucose went up too. So that means that the model worked okay, but the medication was effective in preventing glucose from elevation. So I think the theory works pretty good. I believe there is a great potential for herbal medicine, and if you can make it more effective, and we can potentially create a multi-billion industry alongside the pharmaceutical company. That's it for today. In next video, we will be talking about diabetes. I will talk about insulin resistance. I promise you never heard this before. Thank you for listening. Bye-bye.